Did you know that vitamin D deficiency affects over 1 billion people worldwide? Despite being essential for our health, many of us simply aren't getting enough. In today's video, we'll explore what vitamin D is, why it's so important, and what you can do to prevent a deficiency. We'll also discuss the risk factors, common symptoms, and how to make sure you're getting enough of this vital nutrient. What is vitamin D and why is it important? First, let's talk about what vitamin D actually is. Often referred to as the sunshine vitamin, vitamin D is a fat-soluble vitamin that our bodies produce when exposed to sunlight. It plays a crucial role in several bodily functions, but one of its most important jobs is helping our bodies absorb calcium, which is essential for maintaining healthy bones and teeth. Without sufficient vitamin D, calcium can't be absorbed properly, leading to bone-softening diseases like rickets in children and osteomalacia or osteoporosis in adults. But vitamin D isn't just about bones. It's also vital for maintaining a healthy immune system, reducing inflammation, and supporting cell growth. Research even suggests that adequate vitamin D levels might lower your risk for certain cancers, type 2 diabetes, and heart disease. Causes of vitamin D deficiency. So, why are so many people deficient in vitamin D? One major reason is the lack of sufficient sun exposure. In today's world, we spend more time indoors, whether it's at work, school, or home. Even when we do go outside, we often use sunscreen, which can block vitamin D production. People who live in northern regions, where winters are long and dark, may also struggle to get enough sun exposure. But sun exposure isn't the only factor. Certain lifestyle habits and health conditions can affect how much vitamin D your body produces or absorbs. For example, people with darker skin have higher levels of melanin, which can reduce the skin's ability to produce vitamin D. Older adults also tend to produce less vitamin D naturally. Other risk factors include living in polluted areas, covering your skin for cultural or religious reasons, and having conditions like Crohn's disease or celiac disease, which affect nutrient absorption. Who is at risk of vitamin D deficiency? Now, let's talk about the groups most at risk of vitamin D deficiency. As I mentioned earlier, people with darker skin and older adults are at higher risk. But this deficiency isn't limited to them. 1. People who live in northern or cloudy regions. If you live far from the equator or in areas where sunlight is scarce, especially in the winter months, your body may not be producing enough vitamin D. 2. Indoor workers. If you spend most of your day inside, whether it's at an office, factory, or even working from home, you're likely not getting enough sun exposure. Even when you're outside, many people wear clothing that covers most of their skin, further limiting exposure. 3. Those with medical conditions. Certain gastrointestinal conditions, like Crohn's or celiac disease, can impair the body's ability to absorb vitamin D from food. People who are obese may also have lower levels of vitamin D, as the vitamin is stored in body fat and becomes less available for use. 4. Breastfed infants. Although breast milk is considered the best nutrition for babies, it doesn't contain enough vitamin D. That's why the American Academy of Pediatrics recommends vitamin D supplements for breastfed babies. Symptoms of vitamin D deficiency. Next, let's cover some of the signs that you might be deficient in vitamin D. The tricky part is that the symptoms can often be subtle or mistaken for other conditions, so it's important to be aware. 1. Fatigue. Feeling constantly tired and lacking energy can be one of the first signs of vitamin D deficiency. If you find yourself drained without a clear reason, it might be worth checking your vitamin D levels. 2. Bone and back pain. Since vitamin D helps your body absorb calcium, low levels can result in bone pain, especially in your lower back or legs. You might also notice that your bones feel more fragile, leading to an increased risk of fractures. 3. Frequent illnesses or infections. One of vitamin D's main roles is supporting immune function. If you find yourself getting sick often, whether it's colds, the flu, or infections, it could be a sign that your immune system isn't functioning at full strength due to low vitamin D levels. 4. Depression or mood changes. There's growing evidence that vitamin D plays a role in regulating mood. Fact: studies have linked vitamin D deficiency with an increased risk of depression, particularly seasonal affective disorder, SAD, which occurs during the darker months of the year. 5. Hair loss and slow wound healing. If your body is struggling to heal after an injury or your hair is thinning more than usual, these could be additional signs of a vitamin D deficiency. Long-term health impacts of deficiency. If left untreated, vitamin D deficiency can lead to serious health issues. As mentioned earlier, one of the most well-known conditions caused by chronic low levels is osteoporosis, a disease that makes bones weak and brittle. This condition increases the risk of fractures, particularly in older adults. Vitamin D deficiency has also been linked to heart disease and high blood pressure, as well as a weakened immune system, which may increase susceptibility to infections and illnesses. There's even research suggesting that vitamin D may play a role in preventing certain cancers, such as breast, prostate, and colon cancer. While the science is still emerging, ensuring you have optimal levels of vitamin D is a simple step you can take to potentially lower these risks. How to prevent and treat vitamin D deficiency. So, how can you make sure you're getting enough vitamin D? Let's go over some of the best strategies. 1. Sunlight. The most natural way to get vitamin D is through sunlight. Spending about 10–30 minutes in direct sunlight, with your arms and face exposed, several times a week can often be enough. However, the amount of time you need will vary depending on your skin tone, geographic location, and the season. 2. Diet. While sunlight is the most efficient source, you can also get vitamin D through your diet. Some of the best food sources include fatty fish like salmon, mackerel, and tuna. Other options include fortified foods like milk, orange juice, and cereals. 2. Egg yolks and cheese also provide small amounts of vitamin D. 3. Supplements. If you're not getting enough from sunlight or food, supplements can help. Vitamin D supplements are available in two forms, D2 and D3. While both are effective, vitamin D3 tends to be the more potent and longer-lasting option. Checking your vitamin D levels. Finally, if you suspect you might be deficient, it's a good idea to get your levels checked. A simple blood test can measure your vitamin D levels. Experts typically recommend maintaining levels of 20–50 nanograms per milliliter. If your levels are low, your doctor may recommend supplements or increased sun exposure to get you back on track. Conclusion. In summary, vitamin D is essential for maintaining bone health, supporting the immune system, and potentially reducing the risk of chronic diseases. Whether through sunlight, diet, or supplements, it's important to make sure you're getting enough. If you're concerned about your levels or experiencing any symptoms, don't hesitate to talk to your healthcare provider and get tested. Taking care of your vitamin D levels is an easy step towards a healthier life. So, be proactive, enjoy some time outdoors, and make sure you're giving your body the sunshine it needs. Thanks for watching, and don't forget to like, subscribe, and share this video to help spread awareness about vitamin D deficiency.